Hi, my name is Oluwaseyi Oluwatola, and I'm a 50th PhD student at the Pilon Thomas Lab, and I'm here at SITC 2024. The title of my poster is we're looking at the effect of transdermal bicarbonate buffer therapy on tumor acidity and CD8 T cells in bladder cancer. So now cancer cells have distinct metabolic characteristics that makes them produce lactates in the tumor microenvironment through the Warburg effect. And acidity is a main mechanism of tumor immunosuppression. And patients that have several cancers, they have acidic microenvironments, and most of the time they are given oral bicarbonate to alkalize the tumor microenvironments before they go on to immunotherapies or other chemotherapies. Specifically in bladder cancer, oral bicarbonate has been used to alkalize the urine and also to alkalize the tumor microenvironment to enhance responses. But taking oral bicarbonate is not tenable in humans, and so we are investigating other means of administering this oral bicarbonate, so we can also prevent issues like gastrointestinal disturbances that patients, go through when they take this oral bicarb. And this is a very potent delivery system because it bypasses the gastrointestinal tract, making it much more applicable in clinical studies. And so basically we're looking at the effect of this buffer therapy on tumor acidity and CD8 T cells. And then we basically challenged our mice with MB49 over bladder tumors. And then as we can see that when we look at this treatment in comparison to the control group, we see a reduction in the tumor burden upon treating with DIVE, which is this topical treatment. And also we see that these differences are actually significant. Taking a look also at the survival curve and the tumor weights of the mice, we see that there is a reduction in the tumor weights of the mice upon DIVE, and that DIVE actually also increases the survival of our bladder tumor-bearing mice. And then also in the context of looking at the immune subsets in the tumor microenvironments, we see that although we don't see significant or major differences in the total number of T cells, we do see a significant infiltration of CD8 T cells, as you can see here from the dot plot and the histogram here. And finally, we see that these differences that we see in over-tetramer is significant in the DIVE group compared to the control groups. And also, we wanted to look at the activation status of these CD8 T cells that we see in the tumor, and we see that these CD8 T cells actually express 4-1BB both in the tumor, and this difference is not seen in the spleen. And also our CD8 positive over positive specific T cells, they also express this stimulatory molecule 4-1BB, which is an important marker for activation. And it helps prolong CD8. It helps prolong durable CD8 T cell responses in our mice. And also we looked at the ability of these CD8 T cells to produce inflammatory cytokines that are necessary for T cell immune function. And we see increased TNF alpha, interferon gamma, on these CD8 T cells after DIVE treatment. And also we see that these CD8 T cells are activated as shown here by the expression of CD69. And finally, we wanted to know if this therapy has the ability to alkalize the urine as well as the tumor microenvironment. And so, after just one application of the treatment, we tested the urine of this mice using pH strips, and we see that this treatment is able to alkalize the urine for even up to 8 hours and longer. And then we did some other studies, which I'm not showing here. Just one treatment with DIVE has the ability to increase the pH for up to 12 hours, actually, with just one application. And also we see that there is an increase in the extracellular tumor pH upon treatment with DIVE, even after 2 weeks, where we see there's this steady increase in the pH leading to, which is like a trend towards alkalinity. And also we see a reduction in the total MRI volume upon treatment with DIVE. And we also tested this in a melanoma model. As you can see here, we see that there is increase in the pH, which is, tending towards alkalinity. of the tumor microenvironment, and we see also a reduction in the tumor volume upon treatment with DIVE. So basically, this therapy has the ability to enhance T-cell responses and also to alkalize the urine and the tumor pH in bladder cancer. Thank you.